There definitely are times where a person actually does need a cervical fusion. Like if Dr. Hauser had a severe fracture of the bones in the neck because of some of his crazy athletic events he does, then I would get a cervical fusion. But most of the time when people get cervical fusion, it's because they got, ringing in the ears that doesn't go away, vertigo, terrible neck pain, terrible migraines, and they're found to have cervical instability. So cervical fusion will stabilize the quote-unquote unstable areas. Now, by definition, that means if somebody's recommended a cervical fusion, it means that the doctor is saying that it's instability basically causing the problem. Well, the best treatment for cervical instability is prolotherapy. Prolotherapy, by tightening the ligaments, will cause a stabilization of the neck. And by instability, you just mean excessive movement of the vertebrae one on top of the other. So when there's excessive movement of those vertebrae, it can pinch on nerves, cause terrible pain, cause migraine headaches, cause vertigo, cause all kinds of symptoms. So a much better treatment option for the person is prolotherapy versus cervical fusion, because cervical fusion, when they do a cervical fusion, it means that those vertebrae can no longer move. So where do you think the motion's going to be in the neck once you have a cervical fusion? It's going to get transferred to the vertebrae below it and above it. So all that happens is you've transferred the problem, the unstable problem, the excessive pressures to the vertebrae below it and above it. So that's why people cervical fusion, inevitably a year, 2, 3 years later, you get the symptoms back. They could even be worse. So it's not a good treatment option. A much better treatment option is get prolotherapy, and once there's enough stability of the neck and the symptoms go away, you say to the doctor, really I'm good, and then the treatment's done. And then if later on, a year or 2 from then, you get a little bit of symptoms back because you're working on the computer and a little bit of the instability's coming back, or you get a trauma, then you have maybe 1 or 2 more prolotherapies. Like, you can't undo a surgery. And then surgery, like I said, all it does is transfer the problem. So a much better treatment option than cervical fusion, which is a major operation, is going to be prolotherapy. I'd really encourage people. When the doctor says cervical fusion, don't walk to the prolotherapist, run to the prolotherapist.